Hello, today is April 17th, 2022. My name is Fatima Leija. I am interviewing Ms. Frida Leija for the University Library Special Collections and Archives at the University of Texas Rio Grande Valley, hereafter abbreviated as UTRGV. This project is in partnership with the Voces Oral History Center at the University of Texas at Austin. Please know, Ms. Leija, that this interview will be placed in the University Library Special Collections and Archives at UTRGV and shared with the Voces Oral History Center at the University of Texas at Austin. If there is anything you do not wish to answer or talk about, I will honor your wishes. Also, if there is something you want to talk about, please bring it up and we'll talk about it. The University Library Special Collections and Archives will archive your interview along with any other photographs and other documentation you are willing to share. UTRGV University Library will retain copyright or non-exclusive right to the interview and any other materials you donate to Special Collections and Archives at UTRGV. Because we are not conducting this interview in person, I need to record you consenting to make sure you agree with our interview procedures before we continue. So I'll ask you a series of 6 questions. Please say yes, I agree, or no, I do not agree after each question. Number 1, do you give University Library Special Collections and Archives at UTRGV consent to archive your interview and your materials at UTRGV University Library?
Yes, I agree.
Do you grant UTRGV University Library Special Collections and Archives the right, title, and interest in copyright over the interview and any material you provide?
Yes, I agree.
Do you agree to allow UTRGV University Library Special Collections and Archives to post this interview on the internet where it may be viewed by people around the world?
Yes, I agree.
Do you grant the University Library Special Collections and Archives consent to share your Zoom interview with the Voces Oral History Center at the University of Texas at Austin for inclusion in the Voces of a Pandemic Oral History mini project, which will include posting the interview on the internet?
Yes, I agree.
As you recall, we previously filled out a pre-interview form. We use information from your pre-interview form to help in research. This entire form is kept in a secure Voces server at the University of Texas at Austin. Before Voces sends its UTRGV University Library Special Collections and Archives, we would have stripped out any contact information for yourself or family members. So that will not be part of your public file. Your public file will only be accessible at UTRGV University Library. The final 2 questions ask for your consent on what I just described. Do you wish for us to share the rest of your interview in your public file available to researchers at UTRGV University Library Special Collections and Archives?
Yes, I agree.
On occasion, UTRGV Special Collections and Archives and Voces receive requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or your email with journalists?
Yes, I agree.
Thank you for your consent. Your experiences and stories mean a lot to us at UTRGV Special Collections and Archives. I look forward to what you say in the interview questions. I will now ask. Ms. Leija, thank you for your time. Like I said earlier, your stories and experiences are valuable to us at UTRGV Special Collections and Archives, and to our partners at the Voces Oral History Center at the University of Texas at Austin. Because you were a frontline worker and a college student during the pandemic, I know you have meaningful stories and experiences from what you just witnessed during the COVID-19 pandemic. So before we talk about COVID-19 stories, can you please share with us a bit about yourself, who you are, and how you wish to be known? Who is Frida Leija?
So I consider myself to be a person who's been going through a lot of changes. The pandemic not only affected me as a healthcare worker, but it affected me as my own person. I did realize a lot of things during the pandemic. I made a lot of changes in my career and my mental health and my physical health and the relationships I kept around me, that overall I feel like it had a both negative and positive impact on me. What I wish to be known as, I guess for now, is just somebody who is just trying to figure out how to make it in this whole, and like starting your own business type of person at such a young age, and
Yeah.
that you get to network with a lot of people, but at the same time, you're just trying to figure out who you are, what you want to do, and how you want to do it.
Wow, that's a great outcome of what you went through. This first section of questions asks you to please share your stories and memories from when the COVID-19 pandemic made its first impacts in December 2019 to about summer of 2020. So the first question I want to ask you is, can you share some memorable stories about how you first heard or learned about COVID-19? Whether it was through radio, TV, children, social media, etc.
So I think the first time I heard about COVID-19 was, just social media, the news about like the outbreak starting over there. We would see like the pictures and the videos of how things were over there, people describing their lockdowns and thinking like, wow, like that's such a horrible thing happening over there. We never really thought that it was going to get as bad as over there here. It was just like, it sucks that this is happening, like, what is being done, but you never really worried that that was going to happen here.
Since it was so far away, and
because it
you're
was
at
so
the
far
border.
away, and you were like, no, they're going to take the right precautions. They're going to like pause traveling for now so it doesn't spread.
Yes. What were some early reports or rumors about COVID-19 that you remember back in 2020?
So I just remember like the typical, like, oh, apparently there's one case already here. There's one case in the United States. And then there's one case in Texas. There's one case in Houston. And then like it got closer and closer and closer to where you live. And at the hospital, they would tell us like, it's not necessary to wear your masks right now, like all the time, unless you're dealing with like flu or what's it called, bronchitis patients. Like, do not freak out other patients, do not freak out your coworkers. It is not necessary to wear your mask right now. It is like anything else. It's just the flu. We're gonna get through it. This will be done like in a month.
Okay. At what point did you realize this pandemic was a serious life-altering event? Or do you not think it's serious? And if so, why?
No, it was a life serious altering event. I myself have always been like I guess you could say like a clean freak or a germaphobe. So ever since I heard about like the pandemic, I started carrying like wipes in my purse and like wiping tables and whatever we went to, right? But I think it was when we started actually having cases at the hospital I was at, that it was when you were like, okay, this is real. We started with some cases and, just putting some rooms to COVID-19 patients, which later in the year, it turned out to be almost the entire hospital, which was a COVID-19 hospital. So I think just like the first time that we had patients in there was already like, okay, like this is happening. Hopefully it doesn't get any worse than the 3 patients we have right now, which it did, of course.
Over the last couple of years, what news media, social media, or other sources do you rely on to keep you informed about COVID-19? Why do you prefer these news sources?
I think I do Twitter, because Twitter has these like links to actual news outlets, not like Facebook, that it's just some random person posting what they want. Like
Yes.
Twitter does keep those links to like ABC News or CNN or whatever. And they even have like a COVID-19 in Texas slot, like depending on your state,
Yes.
to where you can check. Also, Google and the CDC. But at some point, well, like we all know, the CDC didn't even know what was happening. So
Yes. Yes, it was something new to all of us,
to everyone,
and having to rely on several sources was,
a little tricky.
yes. Do you remember what was like for you during the stay-at-home orders in 2020? Do you have any stories from this time you could tell?
So when the stay-at-home orders began, I was everybody in my household, like I have separate households because my parents are divorced. So, you know, my mom's household was just staying quarantined, and my dad's household was staying quarantined as well, of course. Um, Everybody in my dad's house was an essential worker. You know, my dad worked for the city, my stepmom
Yes.
worked in a grocery store, my grandma was also a CNA in a nursing home, I was a CNA myself. And then everybody in my mom's household was not an essential worker and got to actually quarantine during that quarantine period.
Yes.
So our stay at home was a little bit different because I would try and go and visit my mom's because we were trying to, you know, take the best care that we could. Um, but they were, you know, not really, like they were really bored of the pandemic, as when you would see it in our dad's household. We were all just trying to stay at home as much as possible because we were already being forced to getting exposed for work, you know. Of course, it was like everybody else. You started the endless amount of recipes for cooking, the endless amount of YouTube workouts, the endless hours of Netflix shows and TikTok. But I think like me staying at home was something I always appreciated because I had no other option when I had to go to work.
Can you share with me what you understand about COVID-19 as an infectious disease and how you feel it has impacted society? Likewise, can you share with me what you don't understand about COVID and wish you could know more about?
So I guess at this point, what I understand about COVID is that it's an easily transmitted disease, you know. Um, Unfortunately, I do not know enough, and I don't know if at this point, like, you know, doctors or scientists know enough about it to like why COVID-19 specifically has such bad sequels. You know, I experienced COVID-19 myself, and other like co-workers or family members that have experienced COVID-19. We all dealt with the sequels of like getting tired super easily. I developed myocarditis after my COVID-19 infection, even though I was completely asymptomatic. Um, I don't understand how or the relation it has on mental health, but I do know a lot of people who suffered from COVID-19 had a very bad decline on mental health, just anxiety, depression, brain fog. I wish I could know more exactly why or how it's related, or if maybe it's just the quarantining yourself in a room. I mean, now it's a little bit more easier to, if you have COVID, you quarantine yourself in your house. Before it was like, okay, your family would lock you up in a room and just leave you the food at the door, and that's it. I don't know if maybe that's what it cost a little bit more, along with patients who were in the hospital. Of course, being in the hospital was a traumatic experience. Just, I guess I would like to know more on like the relationship between COVID-19 and mental health.
Yes. Do you feel your family has the same beliefs as you about COVID, or are there some members who take it more seriously or lightly? If so, how so?
I think that when I was in the hospital, nobody had the same beliefs as I did in my family of COVID-19, other than my boyfriend, who was working in the same hospital with me, the same shifts and the same unit. Um, I do believe some family members took it more seriously than others, which caused a lot of problems during the pandemic, family wise. You know, you had those who were experiencing firsthand, like how you were, who were frontline workers and didn't take it as seriously. Those who were just at home and were taking it as seriously as you. Those who were just at home were not taking it as seriously, you know, just a mix overall of everything. And, you know, I guess it's just a mix and match. Now my family, when I tell them about it, my dad's side still doesn't take it as seriously. My mom's side has now realized that it was an actual traumatic event, what us frontline workers in the hospital went through during the pandemic.
It was a different experience for you
And for everybody in
all
the
of
family.
the healthcare workers,
Yeah.
that people who didn't see it firsthand, they didn't experience it the same way as you did. This next part asks you to share any stories about COVID-19 vaccines and any vaccination-related stories that you may wish to tell. Did you get a vaccine and any follow-up booster shots?
Yes, I did get my vaccine and I have been keeping up with all of my booster shots. I will be keeping up with my booster shots. About the vaccine, I do remember when we used to think, oh no, like the vaccine's not going to come anytime soon. It's going to be so far out because vaccines take so long to make, you know?
Yes.
And then when they told us there's a vaccine ready and we're going to start with frontline workers, in a sense, you were like, okay, this is good, you know, like we're going to get protected as is. On another point, you were like, they're experimenting on us because we don't know what outcomes this vaccine is going to have. I always felt like, you know, whatever, I'm going to take it, whatever it is, you can experiment on me. I don't care. But there were some people who were refusing to. There were some people who, I mean, and they didn't force us to get the vaccine. At the hospital, they told us it's available. This is the information. We encourage you, but it's not mandatory. I don't work at a hospital anymore, so I don't know if at this point they've made it mandatory, since now we have enough like time and enough people who have taken it and there haven't been any serious like risks or what's it called, side effects, right?
Yes.
I used to work night shifts, so the time that they offered it would be in the morning. And I remember my now fiance and we stayed overnight, like the whole time. We got out at 7 a.m. and the vaccines were going to be available as soon as 9 a.m. So we just waited until 9 a.m. after working overnight just to get the vaccine. And then we got it, and we've been following up ever since with booster shots or whatever is needed.
Were you hesitant about getting the vaccine?
No, never.
Ms. Leija, I am now going to ask you a set of questions regarding the impact COVID-19 had on your family life. Ms. Frida, you shared with me in our pre-interview that you have split parents living in different countries. Your mother's side lives in Matamoros, while your father's side of the family lives in Bronzeville. Has COVID-19 impacted your ability to travel across the U.S.-Mexico South Texas border to visit family and likewise have family visit you?
Yes, it was a big time change. At the beginning, where we weren't very deep into the pandemic, the border closed for Mexican citizens to not be able to cross over to the U.S., but U.S. citizens were still able to cross to Mexico. So I was taking advantage of that and going over and seeing my family in Mexico. Once the pandemic hit and we got a peek at the hospital, I decided, and all my family decided, that it wasn't the best option for me to be taking care of COVID-19 patients and going, going home to my mom's side of the family, who were quarantined because none of them were essential workers. And most of them are teachers, so they were teaching from home. My grandmother, who was my biggest worry, was retired by that point. She's still retired. And my uncles, who, they live right next to my mother's house with my grandma. So we were like, they still saw each other. They share a garden, technically. They were dentists, but they did get to quarantine for the first time because it wasn't like in the US that they were using any type of medical worker like dentist and pull them into the hospital for help. In Mexico, they did take that time to just, if you don't really have any experience in the hospital, just stay home. So it wasn't the best decision for me to go and visit while I was handling COVID-19 patients, when in my dad's house, everybody was an essential worker. So we were all exposed at some level, I did go for maybe about, I want to say 5-6 months without crossing over to see my family. It would just be video calls. They could not cross over and see me. And as much as I could cross over and see them, I wouldn't because of the risk. Sometimes we would just cross over the bridge and I would drop off some stuff. They would drop me some stuff like that they needed from over here and that I needed from over there. And we would just switch. But that's as far as we could. I do remember there was no vaccine. I would try to get tested as regularly. And I remember very vividly my grandma, whenever she saw me, she would put on trash bags on top of her so she was able to hug me.
Oh, that's so cute.
Yes, so she was able to hug me without, the risk of infection or anything like that. So it did make it very, very hard, which I'm not thankful that is over at this point. But yeah, it was a 1 year of technically isolation of just work and no family, no friends, nothing.
I'm sorry to hear that. That must have been a very hard experience for you. Can you share with me some stories or examples on how you and your family have adapted your family interactions during the pandemic?
Definitely on my dad's side, it's always been a smaller family, which is really just my dad's both siblings, his sister and his brother, that have been the close ones. Yes. That we used to see regularly. On my mom's side of the family, it was a lot of the extended family that was really close-knit and would see each other almost weekly, cookouts and stuff. So on my mom's side, we did feel that isolation and pull of not being able to see your cousins, your aunts, your, everybody else, that you were it's Easter and we don't get to do what we usually do. It's Christmas and we don't get to do what we usually do. On my dad's side, it wasn't that much because, it was just those two siblings, and we did last for a very long time not seeing each other, but I'm guessing it was just video calling all the time. That's what we used, video calling for everything. We wouldn't even try to do the regular calling. We just wanted to see each other's faces. And the times that we would try to see each other, I do remember sitting in a garden, all spaced out 6 feet apart, still with our masks, just trying to at least be in each other's presence, in person, rather than just over the phone.
In the pre-interview, you mentioned you and your family started a tradition of playing Loteria every week during lockdown. Did you lose any family tradition because of the pandemic? And if so, what family traditions did you lose?
We didn't lose that tradition of the Loteria. That was actually something we started very often. I mean, there was really nothing to do during the pandemic, so Loteria became kind of the thing. We still do play from time to time, but now that everybody's back to work completely, there's been less time. There's been less free time to do that. We lost the tradition of doing those big family parties for everything, those big birthday parties, the big Christmas parties, because now we don't feel safe anymore. And the one time that we tried it this past Christmas, it ended up with a lot of the family members getting sick, even though the reunion was not as big as we used to. It still turned out with some COVID-19 infections. So I think we lost that tradition of big family parties.
You mentioned that only residents and US citizens could cross the border to Brownsville from the beginning of the pandemic up until mid-2021. What cultural or economic impacts did you notice in your community of Brownsville with these restrictions that have closed the international bridges between the US and Mexico for non-essential travel?
Actually, what I got to see in this effect was around spring of 2021, which was when I started changing my whole career. I started working at a place downtown Brownsville. And if you know the Valley, downtown Brownsville is it's now being like, remodeled with a lot of restaurants. But before that, it used to be small local businesses of people just, trying to make it. You had fabric stores, craft stores, small cafes. It wasn't any of that new modern and I guess gentrified coffee shops and expensive restaurants and bars. So and a lot of the people that would keep those downtown Brownsville stores going were the Mexican citizens who would cross over walking and shop around in downtown Brownsville because it was cheaper. You found a lot of good things. Once that stopped, a lot of downtown Brownsville died. A lot of stores closed. A lot of the owners were forced to close down, which ended up in like them selling their buildings. So now downtown Brownsville is not that same community. We still have some businesses that are still thriving and are still, been able to keep open, but a lot of them closed down, after the Mexican citizens were allowed to cross back open. They, you come to downtown Brownsville and they're like, where's all of the businesses? Like, where is it where I used to buy this and where I used to buy that? And now it's all gone.
Yes, it lost some essence after the pandemic.
Yes.
You mentioned you have younger siblings. How has COVID-19 impacted the lives of your younger siblings who were in elementary when the pandemic started in March of 2020 in the US?
I think for them, I see it as being it hard for a kid because they lost on so many experiences that I remember having at their age. They really spent 1 or 2 whole years of their childhood locked in there. You lose 2 years of your childhood without any other social interactions. And my siblings were at the point where they had already experienced some years of school, but I do have, for example, younger cousins who didn't experience that, and at this point are not familiarized with what it's like to go to school and to meet other kids or any of that. At their age, we were already so familiarized with the whole concept of school and going in person and it's 2022 and they have not gotten absolutely anything of that because they are pandemic kids, especially pandemic babies. I do see it. But I also do see it that as a kid, it's simpler because you're not dealing with any of the outside stuff. You're not dealing with I'm pretty sure some kids did have to deal with that, but at least with my siblings, they were not dealing with the economical hardships. They were not dealing with the, emotional trauma of working in a COVID unit, or the stress or the family problems. They were kind of just taking it as a vacation. We were very privileged to go through that because a lot of other kids did not have that opportunity.
Yes. Are your siblings doing better now that they are back in school? Did you notice any difficulties when they were transitioning from remote learning to returning to the classroom in 2021?
Thankfully, like I said, because we are very privileged to not have any serious difficulties. The only thing they struggled with going back to school was learning to keep on their masks and not be touchy with other kids, and just getting back to that routine of going in person after one whole year of just being at home.
You also mentioned that your grandmother suffers, in our pre-interview, you mentioned that your grandmother suffers from asthma and diabetes, and that she worked as a certified nurse assistant during the pandemic. Was this a concern for you and your family?
It was a humongous concern, but it was more of a concern to us than it was to her.
She took it more
God
lightly?
has this big angel looking over both of my grandmas, and they've both experienced COVID at this point, and thank God it hasn't been anything detrimental. But it was a big concern of ours. We later on learned to live with the fact that if it wasn't a big enough factor for her to completely stay home, because my grandma was one of those people who was trying to just get out the house in any chance that they could, then we had to learn that if it wasn't a big concern for her, then it shouldn't be a big concern for us.
You shared with me that you were the first person in your mother's side of the family to get COVID-19. How did you and your family take the news when you found out?
So I was actually the first person on my mother's side of the family. I was the first person in both of my households to get COVID-19. We knew other family members who had got it, but not somebody from our household. It was we took it, as anything because I didn't feel bad, but it was pretty devastating because I was getting ready for my sister's birthday. I quarantined, I took off 2 weeks from work. I got tested and everything. I had no symptoms whatsoever. And then the day that I was supposed to go see my sister for her birthday, I ended up testing positive. They called me with the results. So we took it. It was kind of hard because, we were just looking forward so much to that point where we were finally going to see each other. And then literally the morning before I left to see them, I tested positive. So it was kind of sad, but at the same time, I think we were all thankful that I was the only one on both households who got sick and that I didn't have any bad symptoms. I didn't have any symptoms at all.
Yes. Is there any other stories you may like to share about your family experience during this evolving pandemic? Like how you all adapted to birthday celebrations and holidays or funeral practices?
I think if a lot of people did it for birthdays, we just started doing the drive-bys. And I think at this point that we're not too into the pandemic, we still do the thing of dropping off the gift on the outside. We don't do the big parties anymore. For funerals, thankfully, we haven't been able to, we haven't had to go through a family funeral. We did have my Nona's brother pass away from COVID-19. But we haven't had as many, and which I'm thankful for. We haven't had as many as other families, as many funerals. We've just had one, thank God.
Next, Ms. Leija, we are going to discuss questions that focus on your experience as a frontline healthcare worker in the midst of the pandemic. Ms. Leija, you were employed as a medical assistant from 2019 to 2020 in Harlingen Medical Center. Is that correct?
2021.
Yes, sorry, I misread the question, 2021. Just to get some background on your job as a medical assistant, what were your duties in the hospital like before COVID-19?
So I started my medical assistant journey in 2018 working in a pediatric clinic, which I really enjoyed. I was in love with it, 100%. I really like kids and working with them, but I couldn't continue that job because it was getting in the way of school. When I started in the hospital, it was a complete different thing because I was not working as a medical assistant. I was working as a CNA, which is a complete different change from working as a medical assistant in a clinic to as a CNA in a hospital. My duties were I would get sometimes between 8 to 11 patients. And, it was taking the vitals, taking their sugars, feeding, bathing, just turning when needed, making sure their diapers were clean or getting them up to the bathroom, emptying Foley bags, emptying, bedpans, everything. So it was just more on the personal care. Rather, I didn't really deal with any medication. I got to learn from some nurses about medications and IVs and everything, but it wasn't it was more of like I want to learn and observe rather than like I need to do. So those were my responsibilities as a CNA, just taking care of the patient himself.
Can you tell me of a happy memory you have at Harlingen Medical Center before the pandemic hit your hometown?
Yeah, I worked there for a while, for a year before the pandemic hit. And it was a very weird thing. It was me and other 3 people that graduated high school at the same time as I did. 2 friends of mine and my now fiance. We were boyfriend and girlfriend at the time. We all went in at the same time to work there. We all graduated high school at the same time. We were all going to college for the same thing with the same classes and everything. So we were the youngest CNAs there at the moment. We were 19 years old. I guess some of the happy memories were when we would get out of our shift and we would just drive to the dentist that was next to the hospital. It was probably around 8 a.m. We were all in our scrubs. We were all, sleep deprived from working all night, but we still made the time to go have breakfast with each other. And I guess the 4 of us were the only ones who understood what we were all going through, because we were in the same position at the same time with the same school requirements. So we all now went different paths, but it's just the 4 of us understood what we were going through, because we had been together for already high school and now some of our college years and now the same job.
Did your responsibilities change throughout the pandemic? And if so, how?
Yes. I was lucky enough to be in a hospital that was small enough to not lose control over everything. I knew people and I read and I heard about people who were in bigger hospitals who you would expect that had everything, because they were, just bigger hospitals. But I guess the bigger was also the more control that they lost, and it was harder to keep everything. I guess, yes. I mean, before the pandemic, my responsibility was to care for the patient, but we never really worried about if a CNA went on break, if you would lose your patient and your patient would die. Once the pandemic hit, if you went on break, when you were there, because you were not checking on the patients constantly, your patient could code, which happened to me once with my first patient.
I'm so sorry to hear that.
It was a lot of, more pressure on, because now these patients were getting confused. They were taking off their oxygen. They were taking off their high flow masks and everything. And you were the one who were checking on them, and you were the one who was checking on all the patients. And you had, I guess, a little bit more time because the nurses were a lot more invested into the medication and the care, critical care, especially in the ICU. So it was up to you to sometimes help that confused patient ripping out their oxygen, just make sure that they kept it in. And if you went on break and everybody else was, crazy busy, then your patient died.
I know of many people who worked as a healthcare worker, but once the pandemic started and the peak of the pandemic hit, they quit. Was your hospital short-staffed and was it at full capacity during 2020? And if so, how did this affect you mentally?
Yes, yes, and yes. A lot of people decided to quit for different reasons. I remember some of the CNAs or nurses that were mothers or were pregnant decided that it was better for them because, we didn't know exactly how everything was affecting back then. So they decided to just go home. Some people that didn't have the necessity of working decided to, just quit. It was a different experience because our hospital got travel nurses. So it was just, agencies of these amazing nurses who left everything from they were from and came to help out in those areas that needed it the most. Some of our own hospital staff decided to leave and go do travel nursing on their own because, of course, travel nursing was and is paying way more than if you're hired as a, nurse in a hospital in your area. So it was understandable, of course, for nurses to just look, you're already getting exposed, you're already like pulling away from your family, might as well get paid a lot for it. So, a lot of these nurses were working, to pay off cars, to buy their parents a home, to be able to bring their parents from somewhere else and bring them over to live with them, pay off nursing school, pay off nurse practitioner school, PA school, just overall. We were short-staffed CNA wise. I'm glad to say that we were doing okay nurse wise because of these travel nurses that were there.
Do you recall any conversation with a travel nurse from outside the Rio Grande Valley that you could share?
I have a lot. These travel nurses that I've met, it was their first, time down here in the valley, and I got shifted around a lot in my hospital. I ended up in the ICU a lot of the times when I was originally from MedSurg. So these three nurses that I met, you know, they started and I started. We both started at the same time. So we shared a lot of things. There were things that they would say like, you guys are doing better than, for example, New York. Like you have everything staffed. You're getting N95s more often than we would get back then, which made it feel like it was good, like they would say, no, don't worry, like not everything is lost. You have no idea how it's going back in New York. Like literally there were rooms of dead bodies stacked up on each other, and here you at least have space. I feel for what they went through. They did tell me like once our first assignment was over, especially in New York, like they just couldn't believe what they had seen. Like it didn't hit them until they got on the plane to go back home that all of that trauma sunk into them. And they were like, it's nothing like that here. Like, yes, it's bad, your community is suffering. She's like, but believe me, it could be a lot worse, which always made it seem like there was hope. They were coming from this horrible situations in other places, and when they came here, they would be like, you guys are fine, like we're gonna get through this, which always made it seem like, okay, like not everything is lost, like we haven't gotten that bad, and thankfully we never did get that bad.
You mentioned you worked COVID unit at the start and at the peak of the pandemic. Did the rest of your household fear exposure due to this?
That the rest of my household did what? I'm sorry?
Did the rest of your household fear exposure due to the fact that you were working COVID units and that you were a frontline worker at the start and the peak of the pandemic?
My mom's side of the family did fear a lot for both my risk and their risk of getting infected. Like I said, my dad's side of the family, where I was staying with during the pandemic, we were all essential workers, so it wasn't, that big of a worry or a concern because we were all exposed to it. Like my grandma was also in a nursing home working with COVID patients, and my stepmom was working in a grocery store where, you know, at those, well, you remember at those times, everybody was going like crazy for toilet paper, and you had to make a line,
Yes.
and they rationed out eggs and ham and stuff like that. So we were all exposed to it to some level. So it wasn't that much of a concern. Of course, it was a concern, but not a as big as how my mom's side of the family perceived it.
Were there any activities you did outside of work that helped cope with what you saw during your shifts?
I did a lot of shopping. I online shopping, of course. My boyfriend and I started this thing of just picking up food because, you know, everything was closed at the time for dining. So it's just picking up food and picking different places in the city to eat in our cars and just watch. We got to eat in front of churches, like church, in front of Home Depot, in front of some stores, and we would just pick a different place every time. Um, I also gained a lot of pets during the pandemic, which are honestly like the reason why I kept sane. And I also did start one of my businesses during the pandemic.
Wow, what business did you start?
I had always wanted to do something, and I've always been interested in fashion. I started in accessories, you know, and like just selling accessories, jewelry. Eventually, I do really wanted to go into clothing, to go into a full boutique, but you know, that's gonna be later on.
Living across the border from Matamoros, Tamaulipas, and working as as a CNA, did you notice any difference in how prepared medical centers were for the pandemic in Matamoros, Mexico versus Cameron County hospitals?
Yes, big time. And I think it was more because one, social media, we were able to see that through social media, and another because one of my cousins is a nurse, and she still is working in the COVID unit in the pandemic in Matamoros while I was doing over there. I actually have two nurses, Ana Lilia and Perla. They're both my cousins, and they're both nurses and working during the pandemic. So sometimes when we would talk, we would discuss like how things were going on different sides. And definitely 100%, Mexico got hit a lot harder because of the lack of resources and because of the amount of work that's put on those nurses. Over there, the nurses are both the CNA and the nurse. Over here, nurses were worried about medication and would help us when needed on the CNAs on patient care, at least in my hospital. I know in other hospitals in the US, the nurses had to do both the nurse and the CNA. But Mexico has always been where nurses are both nurse and CNA. So yes, it was a lot tougher on nurses, on their burnout, and on their patients for not having all of the resources that were over here. You know, their hospitals were not in the best conditions. They were not getting, and of course, with corruption in Mexico, like, you know, PPE went missing all of a sudden, and then it turned out being sold somewhere else when, you know, nurses were desperately in need of those type of equipment. So yes, I would see, and it was very frustrating, especially because my family was over there, and you would see, damn, if it's hard for us, and I'm seeing how hard it is for them, if something happens to my family where they need to end up in a hospital, what is it going to be? If we're doing bad and they're doing worse, how is that going to turn out?
In what moment did you realize finding another job would be better for your own well-being and health?
The moment, so I've always thought that I was interested in the medical field, and I found it interesting. I didn't find a passion in it, right? I found it interesting. I found it good. I enjoyed it, but I wasn't passionate about it. I always wanted to get into business. open my own business. I am a very, type A type of person. So I like planning and everything. And sometimes I would mention to my boyfriend, wouldn't it be cool, like if one day I did like wedding planning or event planning, that I took care of those stuff, because, it's just about planning and details and everything. When I was not doing well mentally in 2021 in the hospital, I just cut back on a lot of hours from work to where, things were starting to opening back up in 2021. And I remember my family telling me like, hey, why don't you just get like a second job, like as a hobby? Like, why don't you do serving or work, as a barista, just do something outside of the medical field so you get some money and take a break from all of the COVID stuff. And I was like, okay. I started working in a restaurant. I was going for server, but I started as a hostess, and then eventually they promoted me to event planner, and then they promoted me to management. And I got so into it and I enjoyed it so much that I was like, okay, I'm 100% sure now that the medical field is nothing of what I want, and this is what I want to do. So it was, I guess, summer of 2021 when I decided that, this is medical is 100% not for me, and I'm 100% more invested into business.
What job do you do now, and how is it better fit for you during this stage of the global COVID-19 pandemic?
I am now an event planner, a restaurant manager, and a marketing assistant. It's not that it's the best at this point in the pandemic, but it's something I enjoy and I'm passionate about, and I do see myself doing for the rest of my life, rather than, it's not something I cry about before going into work like I did when I was a CNA during the pandemic.
Ms. Leija, let's now talk about how this pandemic affected your student path at UTRGV. Ms. Leija, you have been a student at UTRGV since 2018, correct?
Yes.
UTRGV has been offering online courses since before the pandemic hit. However, in 2020, most courses were offered online. Did you prefer traditional face-to-face lectures or online courses?
100% online courses, but because I've always liked to work at my own pace. Even when we had in-person classes before the pandemic, I would go to the lecture for attendance, right? But I would rather just study the material on my own time, and then complete the work, because I've always had trouble just sitting there and paying attention. I'm not a person who can just sit for a very long time. So online courses were actually very good and preferred for me.
How did the remote online learning affect your education? Can you tell me some positive and negative experiences you had with online courses?
Well, to me, I enjoyed it more and I was able to learn a lot more. We did have some professors that, although it was the pandemic and we were all like, at this point, we were all just trying to survive, they were still kind of like in their minds that like, oh, I need to test them and I need to see, in 2020, we were all losing family members. We were all traumatized. We were all locked up. We were all like, some of us, like, there's some people who didn't have jobs and didn't have like enough money to get food or put on the tables. Students whose parents lost their jobs and couldn't provide. And even though like that, some teachers were still like so adamant on the grading and the tests and everything. And it's like, at this point, it's 2020. It wasn't even 2021. It's 2020. We're literally all trying to survive. Everybody's trying to survive this pandemic. And some professors were worried about, I need you to honestly learn and pass this course. The courses were the last thing in our mind at that point. Some of us or some people were literally trying to find where to get the money to eat and survive. So thankfully, even though it was a traumatizing job, I had a job where, I could still provide and help. And my parents had a job and they could still, I didn't get hit, but I did know of some students who were struggling with that and whose, professors just didn't make it any easier.
In our pre-interview, you mentioned you switched majors during COVID-19. Did the pandemic have anything to do with this decision?
101,000% yes. The pandemic made me realize that I could not see myself doing that for the rest of my life. Like I could not, it got to a point where I was burnt out, where I started to notice myself caring less about the patient and just caring more about like whether management was going to be okay with what I did or not. And that's not an outlook you can have when you work in the medical field. You always need to care about the patient first, 100%. The moment where I started realizing that, it annoyed me to change a diaper of a person, I was like, okay, I cannot be here anymore. I cannot have this attitude, because me being annoyed and me having that attitude cannot affect somebody's well-being. I could not do that to anyone. I decided to switch. I decided to leave, and I was already doing everything else. I kept the CNA job and I kept the event planning job. And at that point, I just decided, maybe I'm just trying to go more into business administration and trying to how do you say, like, put on my own businesses and stuff, rather than keep on this medical field.
What kinds of policies did the University of Texas Rio Grande Valley enforce in response to COVID-19? Did you agree with these policies?
I do remember like them enforcing masks, them providing the reliefs where like we would get the incentives, where like if we would get enrolled in certain semesters, they would give us a certain amount of money, which was always helpful to just keep making ends meet. Overall, I think they handled it well, except for the times that they would, for spring break, rather than waiting and having everybody quarantined, because obviously there were many students who didn't take the pandemic seriously, and in spring break, rather than quarantining, they went partying, would come back infected and everything. And rather than having the university wait to bring everybody back, they just decided to do so, which did cause some people, not some, but a lot of more, COVID-19 cases, positive COVID-19 cases.
This last section asks you to share any stories you have about this pandemic and the response by local, state, and national elected officials, and express any wishes you have for pandemic stories impact. Feel free to respond or pass on any of the questions. Do you feel satisfied with the local response to COVID-19 in Bronzeville, Rancho Viejo, and Cameron County over these almost last 3 years?
No.
Could you explain why?
I think that some of the things they did were good, but also at the same time, I feel, as somebody who dealt, with the people dying firsthand, put those bodies in bags, my mind could not comprehend how they would put their precious economy before the lives of many people. Because yes, they did cancel some events, like what was it, Sombrero Fest?
Yes.
That's what it's called. But then they were allowing, just things that were not necessary to come back at such early point in the pandemic, but that they said like, oh, it's necessary. And I just think overall, there were a lot of funds going on. There were a lot of people going, and rather than using those funds to, do more donations and do more like, I don't know, I just feel like a lot of the money that they used could have been used to help people to still be able to quarantine safely. And I don't think maybe that's only a Cameron County type of thing, but I think it's a Texas state thing.
Are you satisfied with the state response to COVID-19 led by Governor Abbott over these last couple of years?
Absolutely not. I could go on and on and on about Governor Abbott, but I think he has a blatant disrespect for life and COVID-19. And just overall, I guess this just goes a little bit more into politics, which I do not wish to get into, but absolutely not. Governor Abbott was nothing but causing more distress to those who were actually, working in the pandemic.
How do you feel about the national response to COVID-19 led by President Trump in the year 2020 and then President Biden from 2021 to present?
I think that we could never compare that because they both got to presidency at very different points in the pandemic. I am not somebody who sympathizes with Trump, but I do feel like a lot of the things he did were wrong, and other things were right, like prioritizing the shipment and manufacturing of tests and vaccines, which is what led us, a lot of people, including myself, bash on him for his political stance. But then when you look at like the speed at where everything happened, you just can't compare both presidents because they both were handling things at very different points in the pandemic. Trump got the peak, but Biden was getting like the, slow down. You really can't compare both.
If you had the power of a political office to respond to COVID-19, what would you have done differently?
I would probably have delayed the return to school for everybody. I would not have lifted the mask mandate so early. I would probably try and make a lot more help and funding for those affected. I mean, we were all affected by COVID-19, but I know of some situations where people were not making money because everybody was sick, and you cannot, people lost their jobs, people lost everything. They literally had no other option. Everything was closed. Nobody was hiring because, of course, if businesses were closed, then you can't hire people. But even though like that, I feel like, in that, and then in Texas with the freeze, and then with all of the social movements like Black Lives Matter and police brutality, I just think that everything was happening all at one point, and rather deciding like, okay, let's focus and help each other out evenly, we were still seeing those help to the privileged first and then down the ladder.
Is there any sort of help or aid you could have used at the peak of the COVID-19 pandemic to make your life more manageable or less stressful? Or is there any assistance you wish you had at this point in the pandemic?
I think that it would have been necessary for mental health specialists to be dedicating time to healthcare workers. I think even at this point, a lot of us looked for help on our own, but it was also hard because I didn't work as much as other people, but other people didn't have time to look for this mental, like, mental health resources and mental health help. We had a lot of nurses who burned out, who gave up. We lost nurses themselves who died from COVID, and nobody really talks about it, but healthcare workers are going through and will be going through a lot of PTSD. Now that it's more chill, you realize it. But I mean, I remember at some point I couldn't sleep, and I was traumatized to hearing anybody in my household cough, to the point where one time I was sleeping and I woke up because I thought I was hearing somebody cough so much, and it was just the mop hitting the wall. Like when they were mopping, it was just that, but I thought somebody was coughing. The fact that I could hear somebody going through to the bathroom at night and like taking them a little bit long, and I would just go and double check that it wasn't like diarrhea or vomiting, which were COVID-19 symptoms, just so we could catch it on time. It was just you there's a lot of trauma behind it for healthcare workers, which I think psychiatric or mental help would have been and will be better if it is offered to them.
Do you consider the national response to COVID-19 pandemic in your vote for a presidential candidate back in 2020?
Yes, I did. I felt like President Trump at the time, even if he thought the pandemic was serious, he was just siding with Republicans, because a lot of Republicans, just a lot of people overall, but mainly Republicans, did not think that the pandemic was serious enough to keep everything closed. And I feel like just to keep their vote, he sided with them and their views, even if he didn't believe it was the best thing, because there were videos and interviews where he would say that COVID-19 was a serious thing. He just did it so he could still get those votes, still keep them on his side. And as a president, you can't, you're a leader of a whole nation. You can't really worry about like if people are still going to side with you when you have millions of people's health at your hands. So yes, that did affect it greatly. Also, I've never been a fan of Trump, and you just desperately needed a change in leadership.
What impact or purpose do you wish your story may have on listeners of the Voices of a Pandemic digital archives?
I hope that there's a lot more awareness of the actual internal trauma that healthcare workers went through. I think like a lot of people talk about the burnout, talk about what it is, but the actual traumatic and mental health effects it had on healthcare workers. People don't realize that. I mean, they think like, oh, well, you signed up for it, you knew it was gonna happen, but it's not something you see yourself doing so soon and at such a big rate. You don't picture yourself putting bodies in bags like in big quantities in one shift. That's the last thing you want to do as a nurse, is to keep losing patients, and especially as a 19-year-old. And I mean, when I went in also, I was a 19 and I was 20 and 21 during the pandemic. That's not something you see yourself doing at such a young age at all. So I think just the awareness, and that there needs to be more patience, with healthcare workers, because I am not there anymore. I got to still recover on my own time, but those who never stopped working and who like rode out the whole pandemic, I think they need the attention, and they need the recognition, and they need the mental help that they can get,
That they deserve more than
that
definitely.
they deserve.
Is there anything else you would like to share with me about your experiences with COVID-19 that I have not asked about?
I think like I we covered it all. Like I keep emphasizing, it's just mental health for healthcare workers, because I saw it and I got to a really low point and I got out of it in what I consider in a short time. But it still worries me and pains me for those who are still there and are still gonna keep going there for as long as their careers.
Well, thank you, Frida, for sharing your stories with me and the Voices of a Pandemic Oral History Project.
Thank you.